One of the most dangerous mistakes I see in older adults is this. They take Amlodipine, Losartan, or Lisinopril for years, feel mostly fine, and start to believe the medicine is simple, routine, almost harmless to ignore. Then one day they skip doses, mix it carelessly with the wrong over-the-counter drug, or assume a side effect is just old age. And that is when something quiet can turn serious. A fall, a dangerous blood pressure swing, worsening kidney numbers, a stroke that seemed to come out of nowhere. The hidden truth is that these medications can be extremely helpful, but only if you understand what they are really doing inside an aging body. I'm Dr. Thomas Reynolds, and if you're over 60, especially over 70, this conversation matters more than most people realize. Because blood pressure medicine is not just about a number on a machine. It is about protecting the brain you rely on, the kidneys that filter your blood, the heart that keeps you moving, and the independence that allows you to live life on your own terms. Today, I want to walk you through what many older adults do not know about Amlodipine, Losartan, and Lisinopril. We're going to talk about how they really work, why they are not interchangeable in the way many people assume, the side effects seniors often miss, the everyday habits that can make them safer or riskier, and the warning signs that should never be brushed aside. And make sure you stay with me, because one of the most important things I'll share today is the difference between a manageable medication effect and a sign that your body may need medical attention quickly. If you take one of these medicines now, or someone you love does, I'd love for you to leave a comment with your age or how long you've been on blood pressure medication. Not because numbers define you, but because it helps remind people listening that this is a shared journey. So many older adults are navigating the same questions, the same fears, the same hope of staying strong. Let's begin with the first thing many people don't know. These medicines do much more than lower blood pressure. That may sound obvious, but it is often misunderstood. Many people think, my pressure is high, so the doctor gave me a pill to force the number down. That is too simple. In reality, these medications may help protect delicate organs that can be damaged slowly, silently, year after year. High blood pressure is like too much force moving through old plumbing. Even if the pipe does not burst today, that constant pressure wears down the lining. In the body, that means blood vessels in the brain, kidneys, eyes, and heart can become stiff, injured, or fragile over time. So when a doctor prescribes Amlodipine, Losartan, or Lisinopril, the goal is not just make the cuff reading look pretty. The deeper goal is often to reduce long-term strain on tissues that older adults cannot afford to lose. That matters after 70 because aging already changes the blood vessels. They tend to become less flexible. The kidneys may filter more slowly. The heart may have to work harder against resistance. The brain may become more vulnerable to tiny vessel damage that affects memory, balance, and processing speed. So when blood pressure is managed well, it may help support much more than circulation. It may help protect daily function. And that leads directly to the next thing many older adults don't know. Amlodipine, Losartan, and Lisinopril do not work the same way. People often lump them together as blood pressure pills, but that can hide important differences. Amlodipine is a calcium channel blocker. That sounds technical, so let me translate it. It helps relax the walls of blood vessels so they open more easily, Imagine a garden hose that is being squeezed. Amlodipine helps reduce that squeeze, so blood can move with less resistance. Losartan and Lisinopril work differently. They both affect a powerful hormone system in the body that helps regulate blood pressure, fluid balance, and vessel tightening. This system is often called the renin-angiotensin system. In plain English, it is part of the body's internal pressure control wiring. Lisinopril is an ACE inhibitor and Losartan is an ARB. They are cousins, not twins. Both may help reduce the body's tendency to tighten blood vessels and hold on to pressure, but they do it through different steps in that chain. Why does that matter to you? Because the side effects, the added benefits, and even the reasons your doctor chose one over another may be different. For example, some older adults with diabetes, kidney concerns, or heart issues may be placed on medications like Losartan or Lisinopril, partly because of how they may help protect the kidneys or reduce stress on the heart in certain situations. Amlodipine may be very useful when blood vessels are stiff and pressure is hard to control, especially in older arteries that have lost some of their natural flexibility. So if you were ever told they're all basically the same, I want to gently challenge that. They all may lower blood pressure, yes, but how they do it and what else they may affect is different. And once you understand that, the next issue becomes easier to understand too. Feeling fine does not mean the medicine is no longer necessary. This one is enormous. I cannot tell you how many older adults have said some version of this to me. My pressure has been good lately, so maybe I don't need it anymore. Or, I ran out for a few days and felt no different. That is exactly why high blood pressure is so deceptive. It often causes damage quietly. No warning bell, no pain, no drama. Just slow wear and tear. It is very different from a condition that shouts at you. High blood pressure often whispers or says nothing at all. That means when the medication is working, you may not feel a dramatic change, but that does not mean nothing important is happening. The protection may be silent too. The medicine may be helping reduce strain on the heart, lowering risk to small vessels in the brain, and supporting the kidneys in ways you cannot feel hour by hour. Now, this does not mean you should never adjust medication. Of course, medications sometimes need to be reduced, changed, or even stopped. But that decision should be based on a pattern of readings, symptoms, other medical conditions, lab values, and your doctor's judgment, not on a guess. Especially later in life, when the line between just enough and too much can be narrower. And that brings us to the next thing many older adults miss entirely. Some side effects are mistaken for aging. This is where people can get into trouble. They assume the body is simply declining, when in reality, a medication may be contributing to symptoms that deserve attention. Let's start with amlodipine. One of the more common issues people notice is swelling in the ankles or lower legs. Now, swelling can happen for many reasons in older adults, including vein problems, heart issues, kidney trouble, or long hours sitting. But amlodipine can also contribute to fluid buildup in the legs because of the way it relaxes blood vessels. Many people see puffy ankles and think, well, I'm getting older. Maybe, but maybe not. Lisinopril is well known for a dry, nagging cough in some people. Not everyone gets it, but when it happens, it can be surprisingly persistent. Some people think they have allergies. Others think the air is dry. Some worry it is something worse. If that cough began after starting the medication or increasing the dose, it is worth discussing. Losartan and Lisinopril can also affect kidney function and potassium levels in some older adults. Potassium is a mineral that helps muscles and the heart work properly. Too much or too little can cause problems. You cannot feel your potassium level by intuition. That is why follow-up blood work matters. And all three medications in different ways may contribute to dizziness, especially when standing up too quickly, particularly in older adults who are dehydrated, frail, losing weight, or taking several medications at once. This is one reason I tell seniors not to dismiss new lightheadedness, repeated fatigue, or sudden weakness as just age. Aging is real, but medication effects are real too. And sometimes the body is telling you it needs a closer look. Now here is the fifth thing many older adults don't know, and it is one of the most practical. Timing, hydration, and position changes matter more after 70. A younger body often adapts quickly. An older body may not. When you stand up, your blood pressure has to adjust fast, so blood keeps reaching the brain. If that adjustment is slower, you may feel woozy, unsteady, or faint. This is sometimes called orthostatic hypotension, which simply means a drop in blood pressure when you change position. If you are taking blood pressure medication, especially while also dealing with dehydration, diarrhea, poor appetite, summer heat, or other medications, that drop can become more noticeable. Think of blood flow like delivering groceries to an upstairs apartment. If the delivery system is already running slower, and then you suddenly stand up, the brain may briefly get less supply than it needs. That is when vision dims, balance wobbles, and falls become more likely. So what should you do? Rise slowly. Sit at the edge of the bed for a moment before standing. Drink enough fluids unless your doctor has told you to limit them. Be especially careful during hot weather or if you've been ill. And do not assume dizziness is harmless just because it passes in a few seconds. Also, do not change your dosing schedule casually. Some people do better taking medication at a certain time of day based on how it affects them, their blood pressure pattern, and the rest of their medication routine. But that should be a thoughtful decision, not random experimentation. Consistency matters. Your body likes rhythm. And this leads us to a mistake that catches many people off guard. Over-the-counter medicines and healthy products can interfere more than you think. This is number 6, and I wish every older adult knew it. You may be taking a prescription carefully, then undoing some of that benefit with something you bought at the pharmacy or health food store without thinking twice. Certain pain relievers, especially NSAIDs like ibuprofen and naproxen, may raise blood pressure, affect the kidneys, and create more risk when combined with medications like Lisinopril or Losartan, especially in older adults with reduced kidney reserve. Decongestants can push blood pressure upward. Some supplements may have unexpected effects, and salt substitutes can be a hidden problem for people taking Losartan or Lisinopril because many salt substitutes use potassium instead of sodium. That sounds healthy on the surface, but if your medication already tends to increase potassium, adding more without guidance may become risky. This is why I always say natural, does not always mean neutral, and over-the-counter does not always mean harmless. If you take one of these medications, it is wise to ask your doctor or pharmacist before starting new supplements, regular pain medications, or salt alternatives. That one conversation may help prevent complications you never saw coming. If this is helping you understand your medication in a clearer, safer way, take a moment to like the video and subscribe. Not for me, for you. Because staying informed is one of the most powerful health habits you can build. Now let's talk about number 7, because this one may save people from making decisions based on fear. The goal is not the lowest number possible. The goal is the safest control for your body. Older adults often worry when they see a blood pressure reading that is higher than perfect. Others worry when it drops lower than usual and they feel washed out. Both concerns are valid, but blood pressure management in later life is not a contest. It is a balancing act. Too high for too long may increase risk to the brain, heart, and kidneys. Too low for the individual person may increase dizziness, falls, weakness, and reduced blood flow when standing. This is why good care looks at more than one reading. It looks at trends. It looks at symptoms. It looks at function. How are you walking? Are you steady? Are you thinking clearly? Are you getting tired in a way that is new? Are you drinking enough? Have you lost weight? Are you taking 5 other medications that also affect pressure? In many older adults, home blood pressure monitoring can be very helpful when done correctly. Sit quietly. Rest first. Use a cuff that fits. Take readings at consistent times. Write them down. Bring them to your appointments. Do not chase every single number emotionally. Look for patterns. And that brings me to the last thing many older adults do not know. The medicine is only part of the treatment. Your daily habits still matter. This is not about blame. It is about power. Medication may help control pressure, but the body still responds to sleep, sodium intake, movement, stress, weight changes, hydration, and alcohol. Even gentle walking, better sleep routines, and smarter food choices may support the work the medication is trying to do. In other words, the pill is not replacing your body's need for care. It is assisting it. After 60 and 70, that partnership becomes even more important. Because the body is working with older vessels, slower recovery, and less margin for error, small habits matter more, not less. So if you take Amlodipine, Losartan, or Lisinopril, here is what I want you to remember. Know why you are taking it. Understand that these medicines do not all work the same way. Do not stop them just because you feel fine. Pay attention to side effects that might be mistaken for aging. Rise slowly. Stay hydrated when appropriate. Be careful with over-the-counter drugs and salt substitutes. Follow up on blood work if your doctor recommends it. Track your blood pressure with calm consistency, not panic. And remember that your habits still shape your health every single day. Most of all, do not let fear make you passive. Understanding your medication is not about becoming suspicious of treatment. It is about becoming an informed partner in your care. That is how you protect independence. That is how you preserve confidence. That is how you reduce the chance that something preventable will take away the life you are still trying to live fully. If you are watching this today, I want to leave you with this thought. Growing older does not mean you stop learning your body. In some ways, it means you must learn it more carefully, with more patience, more wisdom, more attention to details that once seemed small. These medicines can play an important role in protecting your heart, brain, and kidneys when used thoughtfully and monitored well. They are not perfect. No medication is. But when you understand what many people overlook, you give yourself something precious: clarity. And clarity creates better choices. Thank you for being here with me. If you take Amlodipine, Losartan, or Lisinopril, leave a comment and share which one you use, or what you wish someone had explained to you sooner. Subscribe if you want more calm, practical guidance for healthy aging. And as always, keep learning, keep asking questions, and keep taking small, steady steps to protect your health and your independence. I'm Dr. Thomas Reynolds, and I'll see you in the next video.